Hi, thank you for joining us. My name is Lori Christensen. I'm an oncology nurse navigator with Legacy Cancer Institute and the coordinator for Legacy Survivorship Program. Dr. Sage Bolte is joining us tonight. She is currently the president of Innova Health Foundation in Falls Church, Virginia, and previously served as the executive director of Life with Cancer and Patient Experience for the Innova Shar Cancer Institute. She is known nationally for her work in sexual health and cancer and is respected as a leader in the field of oncology social work. Her PhD dissertation explored the impact of cancer and its treatments on the sexual self of young adult cancer survivors. We're very pleased to have her share her wisdom and research with us today. A big thanks to the Legacy Health Foundation for sponsoring this event. Without further ado, here is Dr. Sage Bolte.
Thank you, Lori. And it's so great to be with you all. I recognize a few names or faces from attending the male or female conversation around cancer survivorship and sexual health. And before I get started, I just really want to, thank you for coming, whether you're by yourself or with a partner or in a group. Taking this step forward to talk about sexuality, intimacy, and relationships after cancer is a big step. So thank you for your willingness to take time with me tonight. I'm on the East Coast, and so it might be a little dark in my space, but I'm really looking forward to talking to you. Tonight, as we are together, we're going to look at what sexuality and intimacy, what they mean, how they impact quality of life. We're going to explore the possible side effects of cancer and its treatments on sexual and romantic intimacy, but I want to refer you back to the recordings that Legacy Health has so graciously already recorded and are providing. So we're not going to spend a lot of time on a deep dive related to male and female sexual health issues. We're going to talk about a few options, tips, and ideas on how you might, as a couple, increase your intimacy and your sexual health as a couple. And then at the end, when it's not recorded, we will have an open dialogue and questions and discussions around what might be front of mind for you. Why are we talking about intimacy and sexual health during and after cancer? And first of all, what an amazing opportunity that Legacy Health is providing in both validating and normalizing that this is a common topic for people going through a cancer experience or who have completed a cancer experience. And we know that sexual health, intimacy is part of your quality of life and includes your sexual health. And there have been some research that's been done that we'll talk a little bit about. There's a wonderful book by my good friend, Dan Shapiro, called And in Health, which is specifically written for couples on facing cancer or really any illness together. That might be a tool that could be helpful for you as you go through this journey. Let me normalize some of the challenges that you all face as couples. We know that 60% of cancer survivors will experience some form of long-term sexual dysfunction. What does that mean? It could mean fatigue, right? We think about long-term fatigue and its impact on sexual interest, its impact on the ability to do activities with your partner. That could have significant impact. It certainly could affect the more what we might call sex-focused activities, such as erection or vaginal moisture. We also know that fewer than 25% of cancer survivors receive professional support around this area. So once again, I just want to give a kudos to Legacy Health for saying this is an area that we're getting behind, that we want our people to understand, our patients who we care about, to know that they are cared about and that this is a topic that is important to us that they learn about. Oftentimes I hear when I'm working with individuals about this idea of the new normal. And I want to be really clear, the new normal can get very cliche. None of us want to have a new normal. In fact, many of us would like to go back to the old normal. Thank you very much. I wish cancer didn't come into my life. But the reality is this new normal that our bodies experience post-illness or trauma is the body has changed. We've been through physical changes and experiences. You may feel or look different. And the reality of that is not just for the person that's been diagnosed with cancer, but the person who loves the person with cancer, also may be experiencing physical changes due to stress, anxiety, worry. They may feel like they look or feel different because of that stress and anxiety. The other reality is one of the challenges related to intimacy, which is connectivity, human connection, which we are born to want. If you think about Maslow's hierarchy, intimacy is one of those foundational needs. We need to feel connected to people. And as you complete treatment, or if you have metastatic disease and people just aren't understanding the concept of never being done with treatment, you might feel disconnected from yourself, from your family, from your friends. And on the opposite, you actually may feel really supported and connected to others. I often hear people talk about, I was surprised by those who came out of the woodwork to surprise me. My colleague that came forward and disclosed that he had cancer. My friend who said, I didn't know what to do, but I just wanted to show up for you, that I hadn't heard from for years. And then others, your closest friends who disappear out of anxiety or fear. And that intimacy can be certainly impacted. And that's different than sexual intimacy. So there's intimacy within friends, connections, which is part of partnership or sexual partnership, but also separate, and both can be impacted. We know the key issues that couples face are actually pretty common and faced with many traumatic incidences. So patients and partners want help with a wide array of sexual issues. You might have concerns about, how is this going to affect our relationship? How will this affect my sexual health? What will this do to my own self-concept of myself or my body image? And your partner might be wondering the same thing. I'm not sure how to interact with his or her body with an ostomy bag. I'm not sure how to interact or touch her breasts when they don't have sensation. Those are both of you experiencing the same experience with different reactions. It's also really important to just explore and talk about, especially during treatment when you might not feel so great, non-coital sex. So meaning non-penetrative sex, maybe not oral sex, but really just enjoying normal and pleasurable touch. What might that look like? What might intimacy look like if you can't have sex or intimacy in the way that you once did prior to cancer? And we're going to talk about that a little bit more tonight. We know there are multiple factors that contribute to sexual challenges in general for individuals and couples. There's a cancer diagnosis itself. And again, I'm not going to spend a lot of time on this. I'm going to go through the next three slides fairly quickly. I'm going to refer you back to the recorded conversations that we had related to male and female health. So there certainly is an impact from the cancer itself, especially those who have cancer of a sex organ. We also know that psychological distress is critical and occurs in both those diagnosed with cancer as well as the partner or partners. We know that the treatments we give the person with cancer has an incredible impact on sexual function, on fatigue, on all the other areas that might influence the interest in sexual intimacy. Chemo brain, maybe they forgot that there was supposed to be a date one night, or they forgot about some of the things that you recently had talked about. That might be internalized by the partner as they don't think this matters, that they're not remembering, when in reality, it's a chemical issue. It's not a personal issue. It's not a desire issue. We also know that side effects, like I just mentioned, and long-term effects can have an impact. And then just alterations in relationships in general, when you become the caregiver instead of the partner, when the partner becomes the patient instead of the partner, that can start to influence how you find connectivity and really even how you might view one another, and gaining back that balance of partners instead of sick, well, patient, caregiver is really important. At a high level, some of the commonly experienced challenges that impact sexual health and intimacy are really the same for men and women. And for those who might identify as non-binary, all of these issues are relevant. We know that there are changes in erection, there are changes in vaginal dryness, there are changes in interest, there are changes in orgasmic intensity. There are issues related to body image for both. There are issues related to the placement of a medical device, whether it's a port, whether it's an ostomy. There are issues related to things as simple as dry mouth. And you think about dry mouth, it's so interesting when people, actually, when I ask the question, how has dry mouth affected your intimate relationships? Many people look at me like, no one's asked me that before. And then it comes out. Actually, I'm really self-conscious about my bad breath. Maybe they're irradiated in the head and neck. Or actually, I'm really self-conscious that I don't produce saliva in the same way. So talking about simple ways to manage that, sucking on mints, having a lemon drop or a peppermint, and being able to normalize and also empower is so important. The common fears for people with any kind of cancer below the belt, urinary and bowel incontinence or urgency, or if there's been weakening of the pelvic floor, fear of urinary incontinency. We also know that not only do those side effects have an impact on how they view themselves or their own feelings, including the partner, if there's fear around a bag leaking or fear of hurting someone, that can impact the partner as well. I often tell the story of a couple I worked with who I really only saw twice because all they needed to hear from me is, that's normal, how do we talk about this? Was a common scenario. She had had breast cancer. She and her partner had not been intimate since her breast cancer. She had had a single mastectomy with reconstruction. And during the expansion process, so after the mastectomy and when there was a prosthetic in place expanding the skin, her partner, her husband, had reached around to hug her. And she had just had it expanded and was very sensitive, and she slapped his hands away. It only takes one hit, slap, don't, arch of the back, or push away for a partner to know, okay, that doesn't feel good, or that's not right, or she or he doesn't want that. How this partner noted it was, she doesn't want to be touched. So we found all the other ways to speak love to her, brought her flowers, cooked her dinner, made her a bath. And yet when they sat in my office, she burst out into tears and said, you don't want me anymore. You don't touch me anymore. I think everything has changed about our relationship. And then he started crying because what he had responded to was her push away. And what he noted was, that doesn't feel good. She doesn't like it. And then he took it further, like, she must not feel attractive. How do I make her feel beautiful? How do I make her feel loved? And he did all the other things that he thought were sending that love to her. And all it took was normalizing that and giving them permission to talk about it. And within 2 sessions, they were good to go. They were back touching, hugging, kissing, and finding different ways to connect. Because we know that the impact of a cancer diagnosis on the sexual self of the person diagnosed and the partner are significant. We know that distress are experienced by both, and the losses that cancer presents are experienced by both. Oftentimes, I'll start with, in a couple session, of just, this is a loss. What are you grieving? Because what we find ourselves in the cancer world doing is more of that, like, buck up, you can do it, be that survivor, be that fighter. And what gets lost is all the things we also took from you. And that doesn't mean that there can't be amazing things experienced in the things that also were lost, right? We can have a breast taken away and find new ways to find intimacy and connection. Both can be true, but that doesn't substitute the loss. So acknowledging the loss for both people, the grief and loss that the partner might feel of, this is not what I envisioned for us in our next chapter of life. I grieve for the loss of my partner and what he or she feels. We know those role changes can take an impact. Certainly we know that fear of recurrence, both people carry. I often hear especially in the first 2 years, when people are being scanned or there's blood work every few months, is kind of living in 3-month segments. How do I manage that anxiety? And both partners carry that in different ways. Experiences in the change in body image. There might be weight gain, weight loss. There might be devices now on the body. There might be new scars. How do you navigate that as a couple? If there were reproductive concerns, if you had hoped that there might be the ability to preserve fertility and that was taken from you, not only a loss, but how do we navigate that together? And then certainly many other quality of life issues. If your financial situation was affected, if your housing situation was affected, all those quality of life pieces affect both of you, not just one of you. If pain medication was prescribed and there was more fatigue or the cost of medication was too high, both of you experience the impact of that. All right, so we've given a quick overview of all the things that we know can impact a relationship. So what do we do about that? The good news is there's lots of things to do about it. We first know that factors predictive of a healthy sexual adjustment within a coupleship is to have had a good relationship before the diagnosis. Notice it doesn't say perfect, doesn't say without problem, it just says good, right? Is there good, solid communication that occurred prior to a diagnosis? Did you have a satisfying sexual relationship before the diagnosis? Did you have support from your partner? And what was your partner, whether it's the person diagnosed with cancer or not, what was your partner's sexual health? All of those matter into the outcomes of how you navigate the post-cancer world. And that's not to say if you had a rocky relationship prior that there's no hope for regaining a solid relationship. It's just an awareness of where you need to spend the work. So again, I'm going to refer you back to the recordings we had before, but I'm going to at a high level just address some of the ways that you can improve sexual function for both men and women. We know that erectile dysfunction is the #1 complaint for men during and post-treatment, really irregardless of the cancer diagnosis they have. So oftentimes what we will recommend is the PDE5 inhibitors, so Viagra, Levitra, Cialis. A penile pump is an option. In fact, I will encourage many couples to include the penile pump as part of their foreplay. It's just part of their sexual ritual that it is attached. Oftentimes, men need to use a ring or looks like a rubber band at the base of the penis in order to maintain blood flow to the penis. Note, if you are on blood thinners or you're at risk for clotting, you should not be using a penile pump. There's also injections like Muse or Caverject that help keep the penis erect. And then some of the best techniques are just adapting to non-penetrative techniques. If the penis cannot get firm enough to penetrate, there are other ways to be sexually intimate, whether that's oral sex, whether that's cuddling, whether that's reading sexual novels together. There's a lot of different ways to stay connected. And then cognitive and behavioral techniques are really seeing a therapist who can help you reframe what you expect from yourself, what you expect from your partner, and also thinking about what you can do instead of focusing only on what you can't. The other issue that many men report is just a loss of interest. The majority of the time it's related to two things. It's either because there's a low testosterone level or your hormones are low, and so getting those testes is important, or depression and anxiety is present, which is also really normal. So having both explored by your physician is important. Additionally, a loss of interest might show up if there is a mismatch in expectations. So if your partner has different expectations than you do related to sexual intimacy, that can create more distress. It might actually create more loss of interest. And so having those conversations is really important. And often, again, just like I'll talk about with women, when we are focused on, I don't have interest, we stop thinking about that we actually have interest to have interest. So we have desire to have desire. So how do I get my mind to help my body be in the moment? And that may mean taking more time for foreplay, initiating and planning sexual touch. And that doesn't mean intercourse. That might be sensual touch. It might be sexual touch, but really making intention for time to be sensual and sexual. And for women, it's not much different. Addressing the vaginal health issues are so important. And I'm going to point this out because whether you are in a relationship with a woman or a man or a non-binary individual, oftentimes when we expect from a woman to indicate that they're sexually aroused, we're looking for moisture. And after especially a premature menopause induction, or when there's been a suppression of hormones, or just dryness, if you think about how drying chemotherapy is, that affects all of the skin, including the vagina and the vulva. And so if you're looking for the natural cues of vaginal moisture, she may not be producing those same cues. They may not be producing those same cues. And so using lubrication and moisturizers are really important. Lubrication is something you would use on the outside or on a penis or on a toy. Moisturizers are used to insert into the vagina to help with, again, addressing the moisture, regaining elasticity. One of the techniques I often teach about is stretch, strengthen, and moisturize. It's vaginal health. You're stretching by using a dilator, you're strengthening by doing Kegels, and you're using moisturizer regularly. There are other things to think about related to women, including, again, that same thing around mind versus body expectations. What is my mind wanting versus what is my body wanting, right? My body may not feel desire, but my mind is wanting it. So how can I bring that arousal, that desire up to my mind? How can I think about it? How can I set the intention? Which for couples often means spontaneous sex, spontaneous intimacy may not be as pleasurable. For those of us who have kind of gone through relationships, had children, learned to lock our doors, planned quickly when we knew kids were out and they're coming back, all of that, we've learned how to adapt around spontaneous, not being so spontaneous. But some people haven't. So planning your intimacy, planning your sexual encounters actually has great benefit. It allows you time to enjoy it. It allows you more time to connect. It gives you a space knowing that you're not going to be interrupted. And oftentimes when I suggest this to a couple, more often than not with a heterosexual couple, one of the people says, well, if we're planning it, it's not as fun. And I constantly ask the question, help me understand that. How is planning it less fun? And that goes back to the spontaneity idea. But one of the things I would challenge is actually planning, again, as I said before, can actually make it more fun, more enjoyable. And if you are in a relationship and you want to surprise your partner, you may be planning for a couple of days and they don't know, and it may appear spontaneous to them, but it's not spontaneous for you, allowing you to use all the tools and resources you need to make it the most enjoyable experience as possible. The other things I hear when working with couples is I don't feel the same. So I don't feel like my body's the same. I don't know how to interact my new body with my partner or partners. So oftentimes I'll say, focus on the things that haven't changed. We get so focused on a scar or a bag or the breast change or the fact that I can't get an erection, that we get hyper-focused on like 4% of our body. So what are the things that haven't changed? Do you still light up when you see your partner? Can they see that in your eyes? Does your body still feel comforted by your partner? Focus on the things that hasn't changed. And then, the reality is your body has changed. And even as a partner, your body might have changed from the stress that you've experienced. So be curious, get to know your body again, touch parts of your body and see if there's a different sensation that's attached to them or arousal. What helps you feel confident? Is it putting on cologne? Is it putting on makeup? Is it wearing your pajamas? I have no idea, but checking in with yourself and saying, what helps me feel more confident? Is it self-talk? But tapping in and really looking at how can I show up more confident so my partner feels more relaxed and confident as well. And then knowing how to manage any of the symptoms or side effects. The reality is if you have bowel or urinary incontinence, you need to learn how to manage that. And so emptying your bowel or urine prior to intercourse may help decrease the risk of incontinence. And the reality is sometimes accidents happen. So how do you work through that as a couple and find ways to adapt? As I said earlier, starting with self-touch exercises and just getting to know what your body feels like again. Oftentimes, if we're not surrounded by people that we feel safe, celebrated by, secure, lifted up, we feel worse. So choose your community of love. Who are the people that fill you up, that lift you up, that you can say anything to, that are going to be honest with you, but that help fill you up? And then one of the things I'll often do with a couple is a stick figure exercise. As I said before, oftentimes what happens is we get so fixated on that 4 or 5% of our body that has changed so significantly that we forget there's a whole other body that oftentimes in relationships, especially longer term relationships, we've kind of learned what turned our partner on, what buttons to push to make them experience pleasure or for them to have an orgasm. And we keep going to those buttons, hoping for the same response. But after cancer, things often change. So I give my clients a red and a green crayon, and I say, draw a stick figure. With the red crayon, indicate where it just doesn't feel good to be touched anymore, or maybe where you're not yet comfortable being touched. And then with a green crayon, color the rest. 99% of the time, what we see is the majority of the stick figure is green. There's so much skin on our body that has sensation, but we often only focus on the sex organs. So being creative can be really helpful. And remembering that being patient, as cliche as that sounds, having patience is really important because recovery for both of you, it takes time. Trusting your body again, trusting each other, understanding one another again, can take time. So for the couple, some things that you might want to consider and remember. Practicing safe sex, even during treatment, is really important. So using condoms, having birth control, using dental dams, which is just essentially like a piece of saran wrap on the vulva and vagina, covering for any secretions. It just keeps from infections being low. Even if you're in an intimate relationship, if you're on treatment, the risk of infections are just higher. So you want to be cautious. It is okay to be intimate. You might need to adapt what that looks like based on where you are in your treatment, based on your white and red cells, all of that. And you can talk to your clinical team about that. One other would be using sensate focus exercises. So how can you touch one another and reintroduce sensual touch? If you haven't touched each other in a while, this is a tool or a technique I would recommend. Use touch and massage to stimulate closeness. So you'll do it to each other. And in the process of doing that, one of the things that is part of this homework is communicating. That feels nice. I don't like it when that's touched. And for whatever reason, especially in our American culture, talking about what feels good, what doesn't feel good, indicating what feels good, what doesn't feel good, for some of us, that doesn't feel comfortable. So if verbally saying that feels good, that doesn't feel good, could I have more of that? I don't want more of that. If that doesn't feel right for you, can you do it by non-verbal cues? Can you moan or stop moaning? Can you have a safe word that you use when something feels good? Just thinking about other ways you can communicate as a couple around closeness and stimulating what feels good and what doesn't is important. Also related to the sensate focus exercises, it's actually that genital, any kind of arousal or orgasm focus is off the table. This is really about you getting comfortable with touching each other's body again and reintroducing sensual and sexual connectivity. So when you think about becoming intimate again, it might require you to get creative, get back to the basics, schedule a date, hold hands, take time to kiss, cuddle, lay together naked, because some of those things are some of the most intimate things that we forget to do when all we're focused on is intercourse. Most importantly, communicate. One of the things that often gets lost in the cancer experience for couples and any couple as they age together is there's this expectation that you can read their mind. And my grandparents, who were married almost 60 years, my grandmother always used to say, I know him well, but I can't read his mind most of the time. So it's important that when you notice that there is something that you want to talk about, state a fact, state a belief, offer a feeling, and give an action. And I'll give some examples about this in a moment. But saying, for example, since I had my reconstruction, you haven't touched me. I believe it's because you don't find me attractive. That makes me feel sad that cancer has impacted the intimate part of our life. And then give an action, because we're really good oftentimes at like throwing our partner into this explosive bomb, and then we don't give them any action to act on. So the action would be, I'd really love it if you initiate a touch more often. If when I get home from work, you hug me and kiss me. If we made love more often, whatever that might be, give them that action. Always, I encourage you to see a therapist to help work through the roadblocks. This is hard stuff. It requires some stretching. It requires some uncomfortable conversations, but it's so possible. The other thing I would say is remember the things that happened prior to cancer in your relationship. They don't disappear magically. So if there was some rocky roads prior to the cancer and cancer kind of gave you a honeymoon, and now you're experiencing those rocky roads again, really common, go back and find somebody to talk about. And then thinking about other ways that you can experience emotional and sexual intimacy outside of penetration or coitus, not focused on orgasm, but really focused on pleasure, sensation, connectivity. So touch, kiss, holding. How can you initiate more of that versus the goal of we must have penetrative or oral or orgasmic intercourse? So another example of talking about your sexual needs, again, stating fact, feeling, belief, and action. Talk about what's happening with your sex life. Share your thoughts and beliefs about why your sex life is the way it is, how it makes you feel, like scared, lonely, sad, or angry, and then what would please you or make you feel better. And the key is to avoid blame, right? It stays positive, it stays focused on a solution. So for example, we've made love only a few times since my cancer. Fact. I think it may be because my scars are a problem for you, your belief. When we don't have sex, I feel really lonely and I miss being close to you. Sometimes I also feel angry that cancer affects our sex life too. Feelings. Then your needs. I would feel much better if we had sex more often and if it was your idea more often. Or I would feel better if we had more dates more often that led to more intimacy, whatever it might be, stating your needs. Now, the key is, for many of us, when we ask something of our partner and then they do it, unfortunately, many of us go back and say, you're only doing that because I asked you to. So the rule of this is, if your partner does and acts on what you've asked, you don't get to go back and say, you're only doing that because I asked you. You get to respond and say, thank you for hearing me. I really appreciate that you listened. Thank you for responding to what I asked for. And what a different dynamic that is, because the fact that they're responding to what you asked means they heard you and that you matter. When, again, you hear that, as I said, respond. So respond, this is communication 101, but sometimes we forget it in stressful situations. So you seem worried, or I'm sure this is really hard for you. I'm here for you. I want to give you what you need. I want us to feel that closeness. If as a couple you're worried about just performance issues, and this might be one side of the couple, first of all, I think if you're really struggling, if you're struggling with something that you're self-conscious about or you're feeling negative about, whether that's erectile disorder, whether that's ongoing side effects, whether that's body image, depression, whatever it might be, talk to your clinical team. Ask them about what are the options, what could this be? Because you want to rule out any medical comorbidities, you want to rule out any psychosocial comorbidities, and then evaluate the mutual expectations with your partner. What is it that you and your partner are looking for? Because often what happens is there's a thought that there's a disconnect on that your partner wants more intimacy, or your partner wants more sex, or wants to be touched more. But when you talk about it and you come to a mutual understanding, just the fact that you're talking about it and sharing is something that allows you to be more aligned. There are going to be desire discrepancies. That's going to happen. In fact, that happened pre-cancer, it's going to happen during cancer, it's going to happen post-cancer. That's just part of being in a coupleship. So how can you agree upon what each of you need? And if there is a physiological desire, for example, I want to have sex 2 times a week, and your partner says, I think I'm really up for only having sex once, however you define sex. That doesn't mean that you can't masturbate once a week, or you can't find other ways to feel physical pleasure, again, within the agreement of your partnership. Talking about the changes we've talked about is really critical. If you notice there are changes, your partner will not notice unless you communicate. So if you have a scar on your port and it doesn't feel good to be touched, or you feel nothing, or it hurts to be touched, don't assume your partner knows that without you communicating that. Also, when we are wondering about how we talk about some of the changes, how we might improve performance, approach it with a sense of curiosity. So I noticed that when we're kissing, you pull away more, or when we're kissing, you don't seem as interested. Help me understand what's going on. Thinking about how you might bring additional tools into the bedroom with you, or the kitchen, or wherever it is that you experience your sexual connectivity. Thinking about using enhancement aids. That could be a vibrator, that could be a penile pump, it could be moisturizers, lubricants, clitoral warmers, but really thinking about what are all the tools that you need that helps enhance your sexual experience, either individually or together as a couple. And oftentimes they'll say, just go back to the basics. Forget that you knew each other for 25 years and you knew all the things that turned each other on, and go back and be curious. Go back and think about, maybe we don't. This is an exciting time to get to know our bodies in a new way. Hold hands. Go back to some of the simple things that you did when you first started dating. And then remembering, unless you try, whatever that try is, kissing, showing your body to your partner for the first time after surgery, becoming sexually intimate again, unless you try, you'll never know. You'll always wonder. So trying with curiosity can also be a really wonderful experience. It's not uncommon for there to be fear of rejection, and on both parties. So not just the person diagnosed with cancer, but also the partner, fear of initiating and being told no. And someone can only initiate so many times and be told no so many times before they just stop initiating. So being open to having conversations about that is important. But if you are the person diagnosed with cancer, it is important for you to get to know your body and the changes that it experienced related to the cancer diagnosis first. And I would say do that in a private session, in a private area, whether that's in the shower or in your bedroom, but figure out what feels good and doesn't feel good to your body first, because otherwise what happens is you invite a roadmap of potential landmines that if your partner touches something and it hurts, you're going to jump, they're going to jump, and that's going to be the end of it. But if you can anticipate, if you know, touching my breast does nothing for me. If it's pleasurable for you, I can do it, but it's not pleasurable for me, but this part is, then it allows you both to have a much more pleasurable experience. Also, oftentimes, especially immediately after a diagnosis, or when side effects are really hard, there's this idea that kind of cancer is your story. It's the only thing that defines you. And I just always want to challenge people, whether it's their cancer or their partner's cancer, that cancer is just part of your story. It's not who you are. It's not what you are. It's not what you are as a couple. It is part of your story, your individual story and your couple story. And what you make of that is somewhat on you, somewhat on the help of professionals, and then how we lean into what are the things we want to do with it. Not to say at all that cancer is an experience we all should turn into a positive one. I am not of that mindset. I think it's crappy that people are diagnosed with cancer. But what we do with it is within, many times, often, our control. Questions around, is there a right or wrong time to discuss? And this might be whether you are thinking about, can we discuss this now as a couple? Can we talk about sex? Can we talk about the changes? There really isn't a right or wrong time, other than if your partner's feeling really sick, probably not a time to talk about it. And if you're really struggling when, bringing in a professional can be really helpful for that. And again, curiosity is such an important tool. Approaching conversations, approaching your partner's body with curiosity while suspending judgment is so important. And then give your partner an opportunity to respond. If you raise a question, if you raise a concern, if you say that doesn't feel good, let them respond. Don't fill in the blanks, give space, and it might be awkward silence for a little bit, but give them the time and space to respond. For those of you who have children, I happen to have 3, they can be very intrusive and they can suck up a lot of time, regardless of cancer. And that's true for grandkids too. So remembering that marriages in general, partnerships in general, they don't work if we don't take time to also prioritize one another outside of our kids or grandkids. So schedule time out for each other, schedule a night out for the kids on a regular basis or a night in on a regular basis. Be honest with your kids or grandkids. They have lots of questions. And if you're wondering about how developmentally appropriate information is, ask one of the social workers within your group. It's really okay for kids to see you express care and love for each other as well as for them. That cancer doesn't have to impact them. In fact, the more that you can display the safety and security of each other and the home, the greater comfort they have in feeling their own feelings about the cancer diagnosis, or coming to you and asking questions, or recognizing like cancer is just part of what's going on right now and we're all going to be okay. Finding ways to connect with your child is also really important, individually and as a couple. And then laughing, just like as a couple, laughter is one of the most healing, most life-giving gifts we can give to one another. So laughter is so important, and laughing with your kids or grandkids is also so important. For the partner, I'd be remiss to not talk about it directly to you during this talk. So it is okay. It is not selfish. It is not insensitive to have your own needs. Neither of you asked for a cancer experience to enter your relationship. Neither of you wanted it. Neither of you signed up for it. And both of you can have your own feelings about it. Oftentimes I hear from partners, I'm just going to kind of shelve my own stuff because it's more about him or it's more about her or them. And the reality is shoving and parking your own experience doesn't help either of you. So acknowledging it's hard for both of you, or you can find joy in things still, whatever that might be, is important. And then communicating about your desires. I want to be held, or I want to hold you. I need touch. And I know right now you don't feel good. So when you feel good in a few days, I really would like to take 20 minutes to just lay in bed and hold you. Whatever that might be. And again, it might change as the disease or treatments change. Being honest is important. Having a space to talk about your own reactions, responses, fears about the cancer diagnosis is really important. And that can be with a therapist, that might be in a support group, but finding that place to share is so important. Also thinking about asking and exploring, what are the other parts of your partner's body that are still sensitive, or that experience pleasure, or that feel comfort when touched? Certainly, as you have questions, whether it be about sexual health, whether it be about side effects, feeling like you have permission to ask questions is really important. You can ask questions of your partner, like, when I hug you, does it hurt? If I kiss you, does that feel nice? Would you rather I fill in the blank? There's nothing wrong with being inquisitive, and curiosity is such a gift for both people. And then asking the healthcare providers as well. Also, just continuing to be you, whatever that looks like, however that shows up for you. I'm a pretty intense person, so I don't know that I show affection in a relaxed way ever. I think I hug big, I love big. So show up as you, and then approach with curiosity. As I said before, both body, touch, arousal. Does this feel good? Be willing to maybe ask more questions. I notice this has changed. Is this okay for you? The only way that we grow stronger through the process of any change or trauma is by asking and growing together with curiosity. For those of you who have advanced disease, first, I just want to honor that both of you are grieving and may have different experiences than this, and that discussing what may bring you joy and connection may look different, and bringing a therapist in that conversation would be important. Oftentimes I hear from people living with advanced disease that things change, sometimes hour by hour, sometimes scan by scan, but it depends. And that normal can change more regularly than it did if they were early stage or for those they know in early stages. So educating that normal may change regularly, which means adapting to what you need may just be part of the environment that supports you. What does it mean to live between scans? What are the things you can do that really fill you up with joy in between those scans? And sometimes that can impact intimacy, especially if you're feeling fearful. So having conversations about that. Also, I find that if somebody's not feeling well, or if they have a disease that advanced that they can't take care of their kind of daily living, that the partner often becomes the person that's doing the bathing or helping with toileting. And you might not want that. You might want a nurse's aide or your child or your parent or your friend to help you with those. So be willing to have a conversation and clearly outline what self-care activities you want to do for yourself, what self-care activities you might want your partner to do, and then what you might want someone else to do. And then set clear boundaries around that. In addition to setting clear boundaries around caregiving time and couple time, or caregiving time and family time. How do you spend time together as a couple, not connected to caregiver and patient? And that might just be laying on the couch, watching a movie, or snuggling in bed naked and enjoying that time together. Remembering that sometimes the most intimate things like bathing or rubbing and massaging the feet can honestly be some of the most intimate times that you have. You know, you think about, who would you let bathe you? Not many people. Who would you let rub your feet? Probably not many people. Those can be very intimate moments that can be shared between a couple that are sacred, even if sex has shifted to a different way of feeling connected sexually and intimately. When you're thinking about how we maintain intimate moments, again, we've talked about new normal. How do you identify or create? There's flexibility for that. You might have thought Thursday is going to be a date night. I'm going to come home. I know it's 2 weeks after treatment. I'm in a good space. I've had steroids. I'm feeling up, and you might just have a bad day. Being able to adapt to how can we still have a date then, or can we reschedule to Friday, and having the flexibility is really important, because that's just part of the changes that happen during a cancer and after a cancer diagnosis. Some things are unpredictable, like how you're going to feel, and having the ability to adapt versus getting frustrated with the adaptation or frustrated that you have to cancel that dinner reservation, that gets in the way of that connectivity. So being able to be flexible, curious, supportive can be really helpful. How can you create a sensual mood? Usually that's through ambiance, through lighting. I always say, again, like I said before, get back to some of the basics. Put on music, light a candle. If appropriate, have a glass of wine, run a bath, get in the shower together. Do some of those things that we did maybe when we were trying to get to know one another in a more intimate, connected way. Go back to just simple things like praising one another. Put yellow sticky notes on the mirror, reminding the person who's looking back at that mirror that you love them, that you care about them. Scheduling a date or a time away with whether it's your partner or your friends or your family to rejuvenate the body, to give yourself that energy to feel good. That can have a really positive effect on your intimate relationships, whether they're sexually intimate or emotionally intimate. Taking time as a couple to escape, get away, relax. And even if that's just a night away, I have many patients who live a couple of miles away from a hotel, and the way that they kind of separate themselves from the cancer world and vacation is going 2 to 3 miles down the road, getting a hotel room and feeling like they're away from what reminds them of what they're currently experiencing or what they recently experienced. And that's good. That's okay. That is appropriate. Talking to one another, expressing your fears, talking about your desires, sharing your losses, while also talking about what your needs are, so important. As I said before, asking for what you need. There is certainly a risk for asking that you don't receive, but the greater risk is not asking and never receiving. Some of the most important things to remember before we get in our time to talk is appropriate timing of any kind of activity, whether that's sensual activity, sexual activity, just fun activity, can increase both the enjoyment of those activities as well as sex. So if you know by 6 o'clock at night you are done for the count, make sure your partner knows that. Because if they're thinking, oh, everybody's gone or dinner's done and I've washed the dishes and now we can go enjoy time together and be sexually intimate, and you're not in it, that can lead to disappointment for both of you. So timing, sometimes again, that means less spontaneity, but it does mean more enjoyment. So that might mean mid-afternoon, it might mean morning. It may mean, again, being creative on when you can be sexually intimate, and getting creative is so important. Be patient, be kind with one another and to yourselves. This is hard. Cancer is hard. The experience of cancer survivorship is ever changing and hard. Resting during sex, and some people laugh at me when I say this, it's not a marathon, but the reality is sometimes in our world, whether it's pornography or other things we get through social media, there's this like image that sex is the goal is to orgasm. And it might be that it is like to take a long time and really make sure that everybody's enjoying. And that's not everybody's goals. So it might mean you're kissing for a while and then you just take a break and rest. It might mean that you're enjoying sexual intimacy, and whether that's penetration, it's oral, whatever that might be for you, and then you need to rest or you're done. The goal is not orgasm. The goal is connectivity and intimacy, that sacred space that we can offer to one another. Remembering that sex is not the only form of intimacy. And most importantly, that patience and a sense of humor is so critical. Laughing at the noises our body makes. If you have a bag and it makes a noise, being able to laugh about it. If your erection isn't as firm as you thought it would be, being able to just enjoy what it is. Being able, again, to have patience and a sense of humor and the willingness to give space and curiosity to one another is the greatest gift we can give to our relationship. And two things I want to leave with you. One, the skin is our largest sex organ, and very few cancers affect all of our skin. So I want you to think about that. Oftentimes we think about, again, sex organ, penis, vagina, anus, whatever it might be, breasts. And that's just small, right? The largest sex organ we have is our skin. The most important is our mind. Again, very few cancers affect our mind. Because if we set our intention, if we have our desire, that's here. What follows after that intention, after that desire, is up to us on how we want to engage with that. And I love this quote. It's so old, but still rings true, from the Mayo Clinic staff that said, intimacy doesn't have to end with your cancer or your cancer diagnosis. You might have to redefine the ways you express it, the ways you connect, because what you did before didn't work before cancer. So you might have to experience. But again, it doesn't mean that it ends. So with that, thank you so much for your time and attention. And I know we're going to stop the recording so we can have a conversation. Thank you.